us off.
Good morning, everybody. Really, the news is very, very good that I think you're going to hear throughout this entire conversation. I'll leave it up to the health department, the hospital, and others to tell you about some of the pushes related to vaccination and other things that are going on. But the news is very, very good for our city. It's good for our school district, and we've done a great job. And I think our city should be commended for what they've done. We are just a couple of things. I know right here at this city, we'll probably continue. Well, not probably. We will continue to be a little more strict in our mitigation efforts here at City Hall. It continues to make some things maybe a little more difficult for those who need some assistance at City Hall. But what we want to do is just make sure we're still staying ahead of this as mitigation efforts around the city begin to subside and people begin to get back to normal. We told you before that we were really paying attention to what was happening post spring break. And again, I think we have avoided what we might have anticipated. The same thing with Thanksgiving and Christmas. And now we have spring break and things look pretty good. I do want to reinforce what you're going to hear from the school district a little bit later on in their efforts to really just finish out the school year, continuing to be very cautious with their mitigation efforts. The fact of the matter is we have been way ahead of the nation and probably most places even in this state as far as getting our kids back to in-person learning. I think the number I heard was we have around 3,000 people that are on the online academy, and most of that is because of extenuating circumstances. So just a huge applause to our school district for what they've been able to do, and really the ongoing mitigation efforts they might institute just to finish the school year is really a very small ask from those of us in the community for them to be able to finish the school year great, to be able to have the graduations and things like that. So applaud them, and we support the things they're trying to do to just get past what we've gone through this entire year, again, realizing we're way ahead of the nation. Past that, we will, Aaron can fill you guys in a little bit later on, but we will just move our Unified Command Team meetings to the Tuesdays where we have city council meetings. Probably just take that through the end of the school year as well and see where we are. Stand by, because we may have just a Unified Command Team moment where we say there's nothing new to report, at which time we'll give you any information we have, but there really may not be a need to gather everybody. So with that, I know there's a lot of other things going on. I'd prefer to leave this as our COVID call, but I'll take any questions and maybe even a few if you have them related to extenuating issues. But we've had plenty of other press conferences. We can deal with those as well. So not much new to report from our end. So Aaron, I'll be happy to take any questions.
We don't have any just yet, so we'll give them just a second to see if they type any out or raise their hands.
All right.
Okay. Mayor Payton, thank you. And now, Russell, I'll turn it over to you.
Thank you, Aaron. I'm Russell Myers, CEO of Midland Health, and this is a little bit of data from the hospital today. We have a total census of 185 in the hospital. We haven't been below 200 consistently in a long time, so things are beginning to come down as we get into the warmer weather. 17 total COVID patients today, 8 of those in critical care, 9 in the medical unit. Only 5 of those COVID patients are on ventilators, and there's a total of 18 patients on ventilators throughout the hospital. Emergency department traffic was up considerably yesterday at 187 visits in the ED. Our testing volume has really sort of bottomed out in the 600 or so per week range here for the last 4 weeks or so. And the percentages that are coming back positive have been consistently below 6% now for the 4th week in a row. So we are beginning to see less disease incidents in the community as more and more people either have had the virus or have been vaccinated. And that's a really positive trend we hope to continue. In terms of events that are happening now, the one material thing happening at the state level is the expiration of the Department of State Health Services rules on hospital visitation. Those are expiring today, and so the state is leaving hospitals to make our own decisions about visitation limits and masking requirements and those kinds of things. We have our internal steering committee meeting tomorrow to talk about what, if any, changes we would want to make to our visitation policies. I would expect that if they choose to make any changes, they'll be minor. We will expect to continue to require masking, continue to require screening at the entry points to the hospital, limit those entry points, et cetera. But we'll have more to talk about the next time that we meet. If any changes happen of any significance, we'll go get those out on social media and out to the press once we've determined what changes we would like to make. The last thing I'd like to focus on is vaccines. We have had, I think, a very, very successful vaccine rollout so far. We've delivered either in our own facilities with personnel from the Unified Command Team or in regional partner facilities to whom we've allocated vaccine. Now over 70,000 doses of vaccine. By my count, about 64,000 of those have been delivered right here in Midland in various settings, mostly at the Horseshoe and our other mass vaccination efforts. But we're beginning to see a pretty significant decline in demand. And so we hope to do some more things to make vaccine accessible to people in the coming days. And more than anything else, to remind people of its availability, of its safety profile, which is excellent, of the fact that the vaccines are working and are available. For those people who have been hesitant, who have waited for whatever reason, there really is no longer any reason to wait to get your vaccine. And we want to continue to deliver that message in every possible venue. Given that, I'd like to show you something, a tool that we've created with the help of a couple of local professionals to speak to our community about the safety profile of the vaccine and reinforce the importance of getting your vaccine as soon as you can. So Tasa, I'll ask you to play that video and I'll come back to answer questions.
The COVID-19 vaccine was developed very, very quickly, and that is alarming for a lot of people. I have to admit it was alarming for myself as well, but after listening to the experts talk about the process of developing the vaccine and the efforts put into it and the testing done from it, the clinical trials done, I think that we can rest assured that it is safe.
I encourage family members and friends to get the vaccine because it will keep them healthy and their family and their neighbors too, and all people that come around. And also, the sooner everybody gets vaccinated, the sooner things can go back to normal.
I did get the vaccine. I have to admit, when it was first available to me, I paused, I questioned, I considered it. I really considered taking the vaccine because it was some of the first vaccine given out in our community. And I know a lot of people were very cognizant of that and wanted to wait and see the effects. But when I started weighing the costs and the benefits, I'm a mother of 4, and my kids can't afford for me to be sick and go down for that long. And the uncertainty of what would happen if I did catch COVID. As many people in the African American community, I have underlying health conditions. I have hypertension, I have asthma, and it was important to me to be able to safely predict that if I did get the vaccine, the side effects would be minimal at best and definitely more predictable than if I actually caught the virus. I do believe the COVID vaccine is safe and effective. The technology advancements that we have today make me feel very, very comfortable. And I believe in science. When our leading community, our leading officials in the community and at the state and local level, as well as the national level, say it's safe and effective and they're willing to take it and they back it up by science, then I trust it, I believe it.
What I would like to add is that everybody has a role to play in getting rid of this virus and not expect, the doctor or the government to do everything. If you get your vaccine, you are actively playing a role in stopping this virus that has changed everybody's life in the last year. So get vaccinated and you have done your job.
I do support the decision of the NMA. I'm a member of the NMA. I have presented at several of their conferences nationwide, and I trust and believe in that community. And a community that looks like us and also believes in science and has some brilliant leading experts in the community as well. It makes me extremely confident in their support of the COVID-19 vaccine. I believe that when we have people that are in the front lines, in the trenches, doing the work that we can identify with and that look like us and are part of our communities, and they're saying it's okay, we have to start to trust in the medicine, in the science that goes behind the practice of medicine.
Two things I'd like to highlight from that quickly, if I might. Number one, you heard Dr. Moses refer to the NMA. That's the National Medical Association, the country's largest organization of African-American physicians who have strongly endorsed the vaccines. And then to highlight Dr. Odoku's last statement, get the vaccine and you've done your job. It's the one thing you can do that can make a difference to the community, and you have complete control of whether you choose to get a vaccine or not. If you're 16 years of age or older in Midland, Texas, you can get a vaccine today. You can get one tomorrow. You are eligible, and we can make it very easy for you to get vaccinated. You can go to our website at midlandhealth.org/vaccine to sign up. You can call us at 221-4VAX, 221-4VAX. Either way, we'll get you an appointment probably within a day or so, and we can make it very, very simple for you. So please do get vaccinated if you haven't yet, and I'll be happy to take questions.
We have two from Stuart. The first one is, please address the fewest number of confirmed cases in a week since June. What should Midland County residents make of that?
Well, I would say Dr. Wilson's going to be up here in a minute, and you can ask him the same question if you'd like. But my first thoughts are that we've had thousands of people who have been infected and have antibodies to the disease from having a COVID infection. We have thousands of people who have had both doses of the vaccine, both here in Midland and around the region. We are continuing to follow our mitigation practices. The things that we have available to us, the tools we are using, are working. And we really are at a critical moment here where those things are all coming together. We have just a little bit more time to do the masking and social distancing strategies to try to push this all the way to zero. And I think we have ample evidence that those things work, and we need to stay the course.
His next question is, what did you think of the school district's decision to continue with the current mask policy?
Well, I think the school district has been very thoughtful about considering its options, and you'll get a chance to talk to Dr. Atkins in a minute if you'd like to ask her. But I think it's consistent with what we've been saying, that masking and social distancing strategies work, that it's too soon for us to lift those expectations. We're not lifting them here in the hospital among our workforce or our visitors and patients. And so I think at least through the end of the school year, there's ample evidence and prudence in staying the course and continuing what we know has been working. So I have no criticism whatsoever for the school district's decision making. I think it's been thoughtful and considered the reality of where we are.
The next question comes from Danny. He asks, if someone from Mexico has family in Midland, can they get the COVID vaccine here?
Yes, we have no restrictions on, the state's been very clear on this, and we've asked them the question several times. There are no geographic restrictions to getting vaccinations at any site in Texas. So if you can produce some form of ID and you're willing to tell us about yourself, including where you live, then we will put a shot in your arm, even if you're from Mexico. And there are a handful, I think we may have had 10, 12, less than 20 people with Mexico addresses who have been vaccinated so far. There are 2 or 3 other countries represented, people who were in Midland for one reason or another. And we didn't let their home country prevent us from giving them vaccine. Probably 5 or 6 other states have been represented among the people we've given vaccines to. So we're not discriminating. If you're here and you're eligible, we'll give you a vaccine.
The Next question comes from Mitch. He asks, is MMH planning on expanding who it will administer the vaccine to like it did previously? If so, who is the hospital considering opening up shots to?
There's nobody left open to. We're wide open now. If you're, the only restriction we have at this point is age. The vaccine is not approved for anyone under 16 years of age, and so we will not give the vaccine to anyone under 16. But if you're 16 years of age or older, we've removed the restrictions at this point. You can get on our waiting list, get registered, make an appointment, get a shot.
And Tassi, you want to ask your Facebook question?
Yes. Can a patient coming in for a colonoscopy next Monday have a companion with them?
Oh, the endoscopy has been the one area where we have continued to limit visitation because we have very limited waiting space. When you come in for a day surgery procedure, we put you in a room and your family can stay there in the room while you go off to the operating room and then come back. We don't have a like environment for endoscopy patients. So the short answer is still no. I'm sure that's one of the areas we'll look closely at as we consider expansion of visitation policies, but we haven't changed them any yet. So for now, for endoscopy, we're not allowing that visitor to attend. If you have a special request, call, who should they call? Call endoscopy. If you have a special need for whatever reason you're concerned about, do call endoscopy and they'll see if they can make a special arrangement for you. But routinely, we're not allowing visitors in that particular area.
Thank you. That's all the Facebook questions we have.
The next question is, can you talk about how long someone needs to wait to get the vaccine after having COVID?
I think Dr. Wilson's going to come up next, and I'll let him answer that one.
Okay.
He'll be much more likely to give you the correct answer.
Then that's all we have for you, Russell. Thank you.
Thank you.
And with that, we will turn it over to Dr. Wilson, the local health authority for the Midland Health Department.
Thank you, Erin. Good morning. I'm going to go through a few of the numbers from the health department this morning first. The overall case count is 16,852, of whom 14,876 have recovered. There's 924 persons in isolation, 572 that are currently being investigated, 247 deaths in Midland County since the beginning of the pandemic. As Russell had mentioned, the Midland Health has mentioned, the case counts seem to be down currently. We've had in the last week single-digit new cases every day except for 2 of those dates. It's been a very remarkable reduction in cases over the last month or so that we're very, very pleased to see. A little bit of a pop in the hospital census of COVID today, but overall we've been 15 and under for a considerable amount of time now. It's been very, very good. So we're very happy about that. I truly believe it's related to the number of people that have had the infection previously and have some degree of immunity from that, and the really remarkable vaccination effort that we've all made and everybody that's been vaccinated has contributed to. I want to emphasize that, as Russell mentioned, there's been over 60,000 vaccines administered, shots on arms administered. Over 30,000 people in Midland County have been fully vaccinated. We've had not a single significant reaction that's been documented at all. You can look at the numbers across the country. You can look at the numbers specifically in Midland County, and I don't think there's an argument for saying that this is not a safe vaccine. And the opportunity for successfully opening up with complete relaxation only exists if we reach that point of herd immunity. So we're cautiously optimistic about where we stand today, but I really encourage everybody to please go out and get vaccinated. It's safe. It's the right thing to do for the community. It's the right thing to do for your family members, et cetera. So if you're eligible, which is basically everybody over 16, please sign up and get vaccinated. So with that, I'll take any questions.
Stuart asks the same question to you. What did you think of the school district's decision to continue with the current mask policy?
I spoke with at least one of their leading health persons within the MISD last week about that. I fully endorsed what her recommendations were, and that's what they concluded. I think it's the right thing to do for the time being. as the mayor said, we've come to this point by virtue of doing the right thing. Let's hang in there for a few more weeks. I think it's not going to be much longer before we can start having a more relaxed policy among our public, our unified command folks. We're very, very close, but we need to get more people vaccinated before I'm going to feel comfortable being unmasked in public forums. Within our population that we have in the hospital, we've had some conversations, and we'll continue to have some conversations regarding those that have been vaccinating, congregating, and having meetings, et cetera, in a more relaxed fashion. And I think that would be our first steps moving that direction. So if individuals chose to be vaccinated, I think you could take that more relaxed perspective going forward when we get to the point where we're ready to do that. So I think what the MISD is doing today is the right thing to do.
And then can you talk about how long someone should wait to get the vaccine after they have COVID?
At least 2 weeks after recovery.
We'll give them just a bit to see if they have any others. Dr. Wilson, thank you.
Thanks very much.
With that, we'll turn it over to Dr. Katie Atkins with MISD.
Hi, good morning. Katie Atkins, Chief of Staff, Midland ISD. Couple of statistics to share with you all related to COVID. In our district, for students and staff, we have a combined number of 11 cases reported last week. This is really great news, not only from a health perspective, but also from an academic perspective. It shows that we have students who are back in school and they are not sick. It shows that we have teachers teaching who are not sick. So that is really encouraging news. We have several updates to share about COVID procedures. Last night, after listening to feedback from a variety of groups and perspectives from parents, teachers, community members, health professionals, the school board determined that the mask requirements will remain in place throughout the end of this school year. The Texas Education Agency, which we are under, all public schools in Texas are under the Texas Education Agency, has stated that unless school boards take action to the contrary, masks are required for students, teachers, and staff with very limited exceptions. At this time, we are recognizing the progress we've made in Midland with the availability of testing and now vaccines and the decreased number of cases that have been spoken to earlier. And for these reasons, we are discussing easing our restrictions on our visitors and volunteers on campuses. I know that's been something that people have been really itching to be able to get back onto campuses and do that. And our field days, we're going to have more information to share with families around that in the near future. We're also evaluating adjustments on field trips and local, state, and national travel, and that's still under further conversation. We are also very happy that traditional spring events like graduation and prom will take place this year. MISD families have already received this information from their schools this past weekend. And I also encourage anyone who's interested in further information about these things I've spoken to tune into MISD's Facebook Live this evening at 6:45 p.m. Our superintendent, Dr. Angelica Ramsey, is going to be able to address a number of these further questions along these things that I've talked about. But at this point in time, I'll be glad to entertain any questions anyone has for me.
Okay, I'm just getting clarity on one question. Stuart asks, didn't the board members actually say no change will take place at this time and that it could be brought up as early as next month?
They said, right, they said they are taking no action at this point in time. And so is it a possibility that they could bring it up again? That still is a possibility, but that's not a plan at this point in time. So basically taking no action means things are in place until something different changes. One point that was heavily discussed during the board meeting was the importance of maintaining in-person instruction. And going back to what we've heard with mitigation efforts, is that these mitigation efforts, based upon what we're seeing with our numbers right now, are showing a positive trend. And so we don't want to do anything prematurely that would jeopardize that here at the very end. So that was the gist of some of the bulk of their conversation.
We'll see if he has any follow-ups. Katie, thank you.
Thank you.
With that, we'll turn it over to Judge Johnson.
Good morning. Thank everybody for being a part of this. One thing we'd like to say is here at the county, everything, the word of the day is cautious. It took us a while to ramp up to the mitigating procedures that we had. It'll take us a while to go down the other way. We're going the right way, and that's good to see. One thing folks will start seeing is trials are back on. That's a big thing for us. Our courtrooms are back up and running. You will still see the mitigating circumstances we had with jury selections out at the Horseshoe. We'll still be very, very cautious by requiring that people show up for jury duty. So we're making sure we take care of everything we can so to ensure your safety. Speaking of vaccines, want to encourage everybody to get a vaccine if you hadn't gotten one, and know that the process out at the Horseshoe is absolutely flawless. Probably one of the most common comments I get is how quick and easy it was for folks. So it's real encouraging. If you haven't got one and you can make time to go, we highly encourage you to go get one. Other than that, it's just we're kind of slowly getting back to business as usual. So with that, if there's any questions, I'll be glad to answer.
Judge, we'll give him just a second. While we wait, everyone, just a reminder, our next press conference will take place at the next before the next city council meeting. So I will send the information out for that as we get closer to that date. With no more questions, we will conclude this Unified Command press conference. Thanks, everybody.